What if the very medication you've been prescribed to manage your blood pressure is actually doing more harm than good? It's a shocking thought, but it's a reality for millions of seniors taking common blood pressure meds. In this video, we're going to expose the hidden dangers of 3 widely prescribed blood pressure medications, and you might be shocked to find that the side effects could be making you sicker, not better. Atenolol, hydrochlorothiazide, and amlodipine. These are some of the most commonly prescribed blood pressure medications. But what if these pills are actually causing serious side effects, including fatigue, swelling, rising blood sugar, and even heart problems? Have you ever felt unusually tired, had swollen ankles, or noticed your blood sugar rising? You might think it's just part of getting older, but in fact, it could be the medication you've been prescribed. We're going to dive deep into why these medications might be aging you faster than time itself. Seniors are often prescribed blood pressure medications to manage hypertension and prevent heart attacks or strokes. But recent research has revealed that 3 of the most commonly prescribed medications, atenolol, hydrochlorothiazide, and amlodipine, can actually be doing more harm than good. These medications may cause symptoms often mistaken for aging, like tiredness, difficulty breathing, sexual dysfunction, and swelling in your legs and ankles. But the reality is, these symptoms might be caused by the medications themselves. Stick with us as we break down the risks of these medications and show you how you can take control of your health. And if you've taken these medications before, make sure to hit that like button and let us know in the comments. We want to hear about your experiences and whether you've noticed any side effects from these medications. Let's face it, as we age, our bodies change, and some symptoms are often dismissed as just getting older. But when it comes to medications, aging doesn't just slow us down physically. It impacts the way our bodies process and react to medications. So, what makes seniors more vulnerable to these side effects? As we age, our kidneys and liver function decline, meaning that medications are metabolized more slowly, which can lead to dangerous side effects. For example, atenolol can cause dangerously low heart rates in seniors, while hydrochlorothiazide and amlodipine cause fluid retention and swelling. What might seem like a normal part of aging could actually be the medication at work. Now, let's dive into each of these medications, uncover their hidden risks, and see how they may be impacting your health in ways you don't even realize. First up is atenolol, a medication that's been around for decades and is still prescribed to millions to control blood pressure. But here's the kicker. Atenolol lowers blood pressure in your arm, but it doesn't address the pressure in your central aorta, which is the main artery leading out of your heart. Studies show that it fails to reduce heart attacks or mortality, despite the fact that many patients and doctors believe it's working. In fact, some researchers have called atenolol a placebo with side effects, because it doesn't deliver the benefits we think it does. And the side effects? Fatigue, sexual dysfunction, and a rising blood sugar level. These aren't just signs of aging. They're directly linked to this medication. Next up, we have hydrochlorothiazide, a diuretic used to help lower blood pressure by removing excess fluid. Sounds great, right? The problem is, it also depletes important minerals like potassium and magnesium. This depletion can cause dangerous arrhythmias, irregular heartbeats that can be deadly. HCTZ also causes calcification of your arteries, which is irreversible. And if that wasn't enough, long-term use of HCTZ has been shown to increase the risk of skin cancer by a staggering 700%. It's shocking, but despite these risks, HCTZ is still one of the most commonly prescribed medications for seniors. But just because it's cheap doesn't mean it's safe. Now, let's talk about amlodipine. This medication is supposed to help open up arteries and lower blood pressure. But in reality, it causes your body to retain fluid, which leads to swelling in the legs and ankles. This swelling isn't just uncomfortable, it's dangerous. In fact, amlodipine increases your risk of heart failure by a significant 38%. The drug causes a fluid imbalance, which puts additional strain on your heart, eventually leading to serious cardiovascular problems. So while amlodipine may lower your blood pressure, it comes at a steep price: heart failure, kidney issues, and swollen limbs. This is a vicious cycle, and many seniors end up being prescribed more medications to deal with the side effects of each one. Now, if you or someone you love is taking any of these medications, it's time to ask questions. Talk to your doctor about safer alternatives. Don't just accept these side effects as a part of getting older. There are options that could help you feel better. If you've learned something today, hit that like button, share this video, and don't forget to subscribe for more health tips and updates. Your health matters, and we want to help you take control of it. So, why are seniors at such a high risk when it comes to these medications? The answer lies in how our bodies change with age. As we get older, our kidney function declines, and so does the liver's ability to break down and process medications. This means that when seniors take these drugs, their bodies don't clear them as efficiently, causing the drugs to build up to dangerous levels. This is why a medication like Atenolol, which lowers blood pressure, can cause dangerously low heart rates in seniors, because the drug stays in their system longer, amplifying the effects. The same applies to Amlodipine and Hydrochlorothiazide. These medications are working overtime in older adults, and that leads to all kinds of problems. You may have heard your doctor say it's just part of getting older, but the reality is, it might not be age causing these symptoms. It could be the very medications prescribed to treat you. For example, Atenolol slows the heart rate, but in seniors, it causes a mismatch in central blood pressure, putting extra strain on your arteries and brain. HCTZ depletes vital minerals and causes your arteries to calcify, increasing the risk of heart attacks. And Amlodipine, well, it makes your body retain fluids, causing dangerous swelling that's more than just uncomfortable. It puts your heart at risk. These side effects aren't just signs of aging. They're the harmful effects of the medications themselves. And they often go unnoticed because the symptoms are so similar to normal aging. Let me tell you a story about Lester, a 73-year-old man who had been on all three of these medications, Atenolol, HCTZ, and Amlodipine. He was constantly tired, his ankles were swollen, his blood sugar was rising, and his heart rate was dangerously low. He couldn't even walk without stopping for rest. But then something changed. His daughter, who's a nurse practitioner, looked at his health and saw the patterns. She knew that this wasn't just aging, it was his medications. After doing some research and discussing with his doctor, they switched his prescriptions to safer alternatives. And guess what happened? Within weeks, Lester's heart rate improved, his fatigue lifted, and his blood sugar dropped from 118 to 96. His swollen ankles went down, and he was able to walk without stopping. He got his life back, and it wasn't because he was getting older, but because he was getting medicated with safer alternatives. If you've been struggling with similar symptoms, don't wait. Take action like Lester did. Speak to your doctor and ask about safer alternatives. The right change could make all the difference. If you've learned something valuable today, hit that like button and share this video with someone who could benefit from this information. And don't forget to subscribe for more health updates and life-changing tips. Let's break down the science of these medications a little further. Atenolol is supposed to help lower blood pressure, but it doesn't do much for the central pressure in your arteries. That's why it doesn't reduce heart attacks or mortality. It can actually make the heart less efficient, causing a mismatch in how blood is circulated. And as for its side effects, fatigue, rising blood sugar, and sexual dysfunction, those are the result of how it blocks certain receptors in your heart and pancreas. Hydrochlorothiazide, or HCTZ, is another medication that's widely prescribed, but it causes major mineral depletion. It forces your body to dump potassium and magnesium, minerals that are vital for heart health. This can trigger arrhythmias or irregular heartbeats, which can lead to sudden health crises. And it doesn't stop there. Long-term use of HCTZ has been shown to increase the risk of skin cancer by over 700%, simply by making your skin more sensitive to sunlight. Finally, Amlodipine. It opens your arteries, but it does so too aggressively, which causes fluid to leak into your tissues, leading to swelling in the ankles and legs. Over time, this can trigger kidney fluid retention and strain on your heart. The ALLHAT trial showed that Amlodipine increases heart failure risk by 38%. So, even though it's helping with blood pressure, it's making the heart work harder and creating other problems in the process. As we age, our kidneys and liver slow down, meaning these medications stay in the system longer than they should. For example, Atenolol's dosage in seniors can be far too high because their kidneys aren't clearing it out fast enough. This leads to an excess buildup, causing slow heart rates and fatigue. The same goes for Amlodipine and HCTZ. As these medications accumulate in your system, the risks become even greater. That's why it's so important to regularly review your prescriptions with your doctor, especially as you get older. The lesson here is simple. Don't let age be the excuse for feeling poorly. If you're on any of these medications and noticing unusual symptoms, talk to your doctor about alternatives. Your health and well-being are too important to risk. Subscribe to this channel to keep us making more of this health video and share this video with your friends and family. And let's help seniors everywhere take control of their health and live better, fuller lives.